Welcome to my channel. Let's talk about all the major heart disease drugs in few minutes to make yourself pro in cardiac drugs with proper clarity. If you've been diagnosed with a heart condition, students and professional wants to learn about the drugs clearly. Feeling overwhelmed by your heart medications? You're not alone. When doctors mention ACE inhibitors, angiotensin converting enzyme inhibitors, beta blockers, and statins, it's easy to get confused. In this video, we're demystifying the major classes of heart disease drugs. Our goal is to arm you with simple, clear knowledge so you can feel confident about your treatment and take an active role in your heart health. Let's start the video with easy mnemonic ways, that is ABCDs. Now time to break it down to know the drugs groups. First, A for ACE inhibitor, the pressure reducers. These medications relax your blood vessels to lower blood pressure. The ACE inhibitors, which end in pril, are often the first line of treatment, but they can cause a dry cough. If that happens, your doctor may switch you to an ARB, angiotensin receptor blocker, which ends in sartan. Vasodilators, like nitroglycerin, also widen blood vessels and are used to relieve chest pain, known as angina. Second, A for antiplatelets or anticoagulants, also known as the clot preventers, and prevents heart attacks and strokes caused by blood clots. Antiplatelets like aspirin and clopidogrel make platelets less sticky to prevent them from clumping together in your arteries. Anticoagulants, like warfarin, slow down the clotting process. They include classics like warfarin and newer drugs like apixaban. With both, the main side effect to watch out for with these drugs is increased bleeding. Third, B for beta blockers, the brakes. These drugs slow your heart rate and reduce its workload. They're used to treat high blood pressure, angina, and after a heart attack. Beta blockers often end in allo, like metoprolol, and a word of caution, never stop taking a beta blocker suddenly. It can be dangerous. Fourth, C for calcium channel blocker, CCB, a class of drugs that block calcium ions from entering heart muscle and blood vessel cells through calcium channels. This relaxes blood vessels, lowers blood pressure, and reduces heart workload. Examples: dihydropyridinous, amlodipine, nifedipine mostly affect blood vessels. Drugs ends with dipine, dines non-dihydropyridinous. Verapamil, diltiazem affect heart rate and conduction as well. Uses: hypertension, high blood pressure, angina, chest pain, certain arrhythmias, especially non-dihydropyridinous. 54, diuretics, the fluid controllers, help your body remove excess salt and water. They're often called water pills. Diuretics take a load off your heart by reducing swelling and blood pressure. This group includes powerful drugs like furosemide, which is used for heart failure, and a special class called MRAS, mineralocorticoid receptor antagonists. These drugs block the action of aldosterone at the mineralocorticoid receptor, helping reduce fluid retention and lower blood pressure. Common examples include spironolactone and eflurane. Like spironolactone, not only removes fluid but also helps protect the heart from scarring, which also help protect your heart from damage. Sixth, S for statins, the cholesterol managers. These drugs, like atorvastatin, lower the bad LDL cholesterol that clogs your arteries. Statins are a cornerstone of preventing heart disease. If you experience the most discussed side effect, while muscle pain is a known side effect, your doctor can often find an alternative if it occurs. Bonus tips. Seventh, finally, 3 newer classes have transformed heart care. 1. Angiotensin receptor neprilysin inhibitors are a 2-in-1 medication for heart failure that relaxes blood vessels while also boosting the body's natural protective hormones. Example: sacubitril or valsartan used in heart failure. Sacubitril inhibits neprilysin, increases natriuretic peptides. Valsartan blocks angiotensin 2 receptor ARB effect. 2. SGLT2 sodium glucose cotransporter 2 inhibitors were first developed for diabetes but are now a pillar of heart failure treatment for many patients, even those without diabetes. SGLT2 inhibitors, for example, dapagliflozin, empagliflozin, block this reabsorption. Glucose is excreted in urine, lower blood sugar, and also provide heart and kidney benefits. 3. GLP-1 glucagon-like peptide-1 agonists, famous for diabetes and weight loss, are now also FDA approved by the Food and Drug Administration to reduce the risk of heart attack and stroke for many people with heart disease. These medications are like tools in a toolbox. Often a combination is used to protect your heart. Your treatment plan is personal. Never change or stop a medication without talking to your healthcare team. Ask questions and be a partner in your own health. Remember, this video is for educational purposes only and is not a substitute for professional medical advice. Thanks for watching.